Good morning, ABC Medical Center. Thank you for being here with me today. My name is Megan and I'm your CEO. We are going to go over our newly acquired electronic health record system. We choose to acquire this new system so that we can get our patients more involved in their healthcare and their overall general health. As you all know, we have been working on this for the past couple of months, and we will be launching our system in our clinics and hospitals, giving our patients the best possible care for their specific needs. To do this, we as a group should have the capacity to adjust new advances. Staff will be able to utilize and speak with patients through new media outlets to keep them knowledge and educated. This is the reason we have recently obtained this new EHR system, which will not only be an advantage to our patients, but it will make our life a lot more easier. Benefits of the new system is that we will have access to all the patients' demographics in all places. So we will be going over some of the applications. MyChart is an application the patients will be able to access by the patient having access to their own important health information on the MyChart. They'll be able to access immunization records, lab results, and screenings due dates. In electronic form, it makes it easier for them to manage their health, and they can be more engaged in health and their overall health care. They are also able to coordinate and combine information from multiple providers which promotes better health care for them. This will give us their overall medical history in one single place. An advantage for the patients and the provider is a function of being able to access patient records from anywhere when they travel in case they have any emergencies. Another benefit is if the patient came in which a medical issue that he or she was having in the past, you would not have to flip through multiple pages of medical history. They will all just be in one single app, and we can also create a search mechanism to see what medical issues they have had in the past or what kind of medications they are currently taking and being subscribed. This saves so much time. It also helps with establishing whether if patients need to be referred to any kind of specialist or they need any kind of special direction. A patient is also able to set up their appointments on MyChart. Billing is available on the MyChart app as well. A patient is able to see their bills and pay them, and also they can see what their copay is going to be before an appointment. They are able to see notes from the previous appointment that they had and send and receive messages to their providers. And we would have to make sure to tell them that they have to wait a full 24 hours sometimes to get a response back. Communicating with our patients will be easier and faster using this new system. With open lines of communication, we will be informed earlier of health problems and assure them that we can get them to the correct provider and healthcare facility. Patient relationship, of course, electronically has to be verified through them. So they will have to sign a document stating that they are okay with everything that goes on within the app. They are also able to access refill prescriptions through the MyChart. Another amazing way to communicate with the patients is through social media, such as Twitter, Facebook, and LinkedIn. This is a really good thing because it helps with the new generation of patients that we have coming in. So they'll We will utilize these social media apps to broadcast health information, updates to patients, and keep them up to date. Examples are like diabetes, smoking, and obesity. Social media is intended to provide our patients the ability to access information quickly and to communicate with others. We will utilize these tools along with other websites to share information with patients in a variety of ways, such as sharing general information about flu shots and tips to avoid common colds or severe colds. Of course, we cannot forget, and it's important that all patients' specific information is required permission. We will have training for the next few weeks. Today we have myself and other leaders in IT here to answer any questions you may have to make this a smooth transition to the new system that will be better for our patients and for us. I'm excited to get started.